Antonio Ruiz. Welcome back to the 1619 podcast. I'm here with Thomas Fields. Hi, Thomas.
Hello.
And we're going to be talking.
We are doing this real time, aren't we?
Yeah, I have to say that this is chapter 12, medicine, and we've got 6 more chapters to go. But one of the things I love about this book is that they begin most chapters with some really interesting stories as examples and setting up the theme of the chapter. And in this one, they are talking about a Black woman, Susan Moore, who was a doctor, graduated in 2002, who unfortunately caught COVID in 2020. And she was checked into Indiana University Health North Hospital near Indianapolis. And she posted a video on her Facebook page that showed her lying in her bed, a breathing tube inserted in her nose. And she's describing detailing what she described as this disrespectful treatment by a white physician, whose name she took the time to spell out. He apparently rejected her plea for additional doses of an antiviral medication used to treat COVID, and said that he did not even listen to my lungs. He didn't even touch me in any way. And the point, of course, unfortunately, she died 2 weeks later. But what was important about this example was the assessment of the U.S. healthcare system, where first, as a Black American, she was more likely to contract COVID-19 than a white American. And second, that she was more likely to die from the disease. Around the time of her death, the Centers for Disease Control and Prevention released data showing that Black Americans were 1.4 times more likely than white ones to contract the virus, 3.2 times more likely to be hospitalized, and 2.8 times more likely to die. These figures have been around now for a couple of years, and of course they're talking about COVID here, but it's been well documented in study after study that when it comes to healthcare, there was this discussion a few years ago about Black women who were pregnant and who had greater harm to the delivery of their child than white mothers. Let's just start there. Your reaction.
This stuff is so well known, so well documented. It just starts with a number of people of color that actually happen to be physicians in this country. Start with that. You go in, and I've personally experienced it, I'm sure you have. You go to a medical facility and you're often treated as a specimen that's not worthy of being there. And that's even, when you're quote unquote middle class and in a quote unquote well-respected facility. It's something that happens, which I think is probably true of most physicians in their training. They're taught to look at people as not people, and look at people as basically, you're a disease or an ailment. And it gets double when you talk about people who have Black skin or brown skin. They're even less worthy of treatment. And I know a few doctors, a couple of them fairly well. And there is, among a couple of them, the fact that they spent enormous amounts of time studying to be a doctor. They accrued enormous amounts of money spent to become a doctor, and they come out of it with this viewpoint that they've got to somehow make back this at the expense, I found, of the people they're treating. That's why you have seen, we talk about the lack of empathy, a lack of a bedside manner. That's a lot of what this comes out of. This is just an outgrowth of that, which is probably is worse if you happen to be a person of color, a person of limited income.
I found it really interesting how they, in this chapter, went back and gave some historical background, the way the medical establishment looks at people of color, particularly in this case, we're talking about Black patients. Going back to times when of enslavement, that they were never, that Black people were not treated the same as white people because they were not thought to be the same. They didn't have, they could endure incredible amounts of pain, for instance, which I'm going, where do they, how can you believe that? There's a line in here: the medical establishment has a long history of mistreating Black patients, either by failing to take their sufferings seriously or by dismissing their concerns. And this often comes in a context of pain management. And this is what happened to Dr. Moore. And just historically, from medical experiments like the Tuskegee study, I guess, and this has been a question mark about how doctors are trained, because you can train a doctor in telling the difference between the pancreas and the liver. And all of us have had experience of when we go to see a doctor, whether it's in a hospital or in a medical clinic, where there are some doctors who, like, empathy is not in their vocabulary.
Mm-hmm.
Sensitivity is not in their vocabulary. I'm always been very lucky. The last two, my doctor now, I've been seeing him since the late 90s. And before that, there was another doctor I had for a short period of time when I lived in San Pedro. They actually sat down and spoke to me. Mm-hmm. Now, I'm sure it was, annoying to the person after me who's wondering, where the hell are you? I had to wait too to see him. And that, unfortunately, is not the experience of a lot of people, and even worse, people of color. And in this context of this chapter, Black people. What are they doing wrong in medical school?
Well, let's start back. You cite examples that during slavery, Blacks were not perceived as being human. There's a wonderful quote here from Thomas Jefferson, who owned slaves, fathered enslaved people, their children. And he said, they secrete less by the kidneys, more by the glands of the skin, which gives them a very strong and disagreeable odor. Okay. Then he goes on to say, they seem to require less sleep. A Black, after hard labor through the day, will be induced by the slightest amusements to sit up till midnight or later, though knowing he must be out with the first dawn of the morning. Talk about self-justification of, your inhumanity. But, even setting that aside, and it's hard to set that aside, that belief system. But remember, hospitals, not just in the South, but in the North, was segregated. There's a number of examples. Betsy Smith died from a car accident because they wouldn't take her to the nearest hospital. Okay. In World War II, the Black blood was separated from white blood, the perception being, or the belief being, that it was somehow tainted. Now, understand something about that, as being so how pernicious it was. The man who discovered plasma happened to be a Black doctor. So, it's beyond irony. It's beyond irony that, but again, we're talking about barbarous behavior by people, and these are medical people who are educated people who should know better, but have been trained, and particularly in those days, and I think up to this time, that somehow there's a difference. Although every scientific study, every legitimate scientific study shows that there's no difference between human beings of one color and another color. But somehow or another, those beliefs continue to this day.
I have to say, one of the paragraphs, the problem of minimizing Black pain has been well documented in scientific literature. And it talks about a 2013 review of studies examining racial disparities in pain management. And it said that found that Black and Hispanic people, from children to elders, received inadequate treatment for pain, especially as compared with their white counterparts. And the background to this is, for the historical background to this is, for centuries, white physicians and scientists went to great lengths to prove that Black bodies were biologically and physiologically different from white bodies. Different meaning always meant inferior. And they used their expertise and empirical data to insist that enslaved Africans were fit for slavery and that the institution was not immoral or cruel, as Thomas Jefferson, but a lot more people said this over time. And they then talk about how these theories became incorporated into a normalizing medical practice. But I go back to my question about, you can teach the difference between, the liver and the pancreas, but and this has been my experience with people who are not my regular doctor, and this doesn't just extend to doctors, this extends to everybody in the office or in the clinic or in the hospital, whether they're nurses or practitioners. It's like, I grew up in the South Bronx, and there was a hospital when I was born at, Lincoln Hospital, that came to be known as the butcher shop. It got that nickname because, you didn't know whether, if you went in, you were coming out in the same, alive. I'm just amazed that we're still talking about this in 2022.
I'm not, though. I'm not at all. These beliefs are handed down, generation, along with the trauma. And we haven't talked enough about generational trauma that creates a lot of illnesses, mental as well as physical. Why do you think that Blacks have higher blood pressure? It's the trauma. Of dealing with everyday racism. It's a trauma that's been passed down, through through things going back to lynching. That trauma, and it's been documented, trauma is passed down through the bloodstream. I'll just tell you a personal story about what I know about how doctors treat Black pain and Black patients. It comes back to my mother. My mother was a dialysis patient. She was on a dialysis machine at least twice a week. And this was going on for a number of years. She gets a new doctor. Now, anyone who's on dialysis machines develops these sort of welts on their arm where the needle's gone in and they put the blood in, right? And, they're unsightly, but you wear a long sleeve shirt and you cover them up. Her new doctor, who has been with her for, I don't know, a couple of months or so, makes the decision, and unfortunately she concurred, that, I can get rid of those welts. We'll just do some surgery. Now, here's someone who's got high blood pressure, who's someone who is on dialysis, kidney dialysis. You perform surgery, cosmetic surgery, unnecessary surgery. So what happens is, of course, she goes in, she has it done, because my mother's from the old school, doctors, you believe your doctor, what he says, what he recommends, because he's recommending in your best interest. And less than 2 weeks later, she is in the kitchen, she is cooking, and the blood vessel in her arm burst where she was operated. My father, fortunately, who had some kind of training in that from World War II, did a tourniquet, put her arm in a bag with blood's coming out, and rushes off to the hospital. He gets to the hospital. She lingers for a couple of days. Now, the reality was that the doctor did that. The doctor did unnecessary surgery. He put his patient's life in jeopardy. And this is the unfortunate thing when I keep hearing about people talk about malpractice suits. My father didn't sue. Primarily why he didn't sue, and I questioned about it at the time, is because he was traumatized. And his thing was he didn't want to relive it on a court.
Yeah.
So
and it's difficult fighting the medical association.
Yeah, exactly. Of course it was. So he's going to have to find a doctor. He's going to have to pay the doctor, and he's going to have to deal with his own trauma from having to deal with his wife.
Yeah.
And so this doctor, who was negligent beyond belief, gets away with it. But this unfortunately happens all too frequently among people who are poor and people of color. And so one of the things that I could get back to is that this chapter on medicine ends with something that's almost like a refrain, which they say through the chapter several times. This is how Black people get killed.
Right. Yeah. I was just looking down at a paragraph that I completely forgot about, because we were talking about how medical students get trained, and they did a study. I guess this is 2016, a study of 222 white medical students and residents. And it was published in the Proceedings of the National Academy of Sciences. So this is no, fly-by-night organization. And showed that half of the students and residents endorse at least one false idea about biological differences between Black people and white people, including that Black people's nerve endings are less sensitive than those of white people.
Yeah, of course.
I just, again, this is 2016. I bet if you go and we researched of any recent studies, surveys, we would probably find similar kinds of things.
Oh God, yes, you would.
And and part of this goes back to things that we've talked about before. If you grow up in a silo, and all your exposure to Black people or any people of color is in these kinds of settings, or they park your car, or they
do your gardening,
or you just see them on television. You have no real interaction with them, except the perceptions that are, particularly nowadays with social media. This is where you get your ideas about other people. Then it's not surprising. I got to go to this other. I guess I knew this. Oh my gosh, tennis star Serena. A few years ago, she talked about the experience she had, Serena Williams, about her experience when she was having a baby. Now, this is a woman who's married to a white guy who's got
a wealthy white guy.
Yeah, and she's wealthy herself.
She's wealthy in her own right, but he's also wealthy. Right.
And talked about her experience giving birth and the insensitivity and the postpartum delivery. Black babies are more than twice as likely as white babies to die at birth or in the first year of life. A racial gap that adds up to thousands of lost lives every year. African Americans, adults of all ages, have elevated rates of conditions such as diabetes and hypertension that among white people are found more commonly at older ages. This also goes to the way we think of healthcare in this country. we don't think of it as a right. We think of it as a commodity.
Well, it's a privilege to
It's a
have healthcare.
privilege. Yeah, it's a privilege, but it's a privilege, a commodity to be bought,
Yes.
and with a lot of money. And the better your health, I know I remember, discussions about, if you do have health insurance, you know, what are the benefits that you have? Do you have the Cadillac of health insurance, or do you just get by with very basic things? And prior to the, I hate to call it the Obamacare, but prior to that, people had very few options if you didn't have health. And so this is sort of, I don't want to take our eyes off of this specific thing, but I think we have to look at the bigger context, as you said in the last chapter, the bigger picture of the healthcare system in this country. If you don't have a job if you have a job that does not offer health insurance, if you live in a state where you have very few options, because the state regulates healthcare in that state, or doesn't regulate it, this says a lot more about the American healthcare system than anything else, and that we are just way behind compared to other so-called Western nations.
Yes, that's true. And, it's abominable. It's an abominable state of affairs. Again, it gets back to race, though, because those Western industrial nations that have healthcare that's considered a right, national healthcare, one of the things I suspect is happening there is that the society is looking at the greater good for its citizens. Its citizens happen to be of predominantly one race, when those care. So there wasn't a matter of saying, well, we're going to select who gets better care or who doesn't get better care. Here, one of the reasons why healthcare is the way it is because you have a large number of people who are not white. And as a system that we have, you really want to have those people be less cared for so that they are really going to be low wage, so that they're going to take the jobs that are offered to them, those jobs which do not come with healthcare. And you think about it too. In this country, your healthcare is tied to your job.
Yeah.
Okay? Think about that. That means. And particularly today, when when you can have jobs, a lot of these jobs, low wage jobs, do not come with healthcare. In Western industrialized societies, that is not the case. Healthcare starts at birth. We attached it to jobs for a specific reason, because we did want to keep people basically enfeebled, have them actually be healthy enough to work. And this again comes out of slavery. You work them until they drop. They are an asset. When that asset has lived through its time, you cast it off and you bring in another asset. That's what our health system is set up to do.
But it's such a
draconian. Yes.
Besides racist and draconian, people listen. The cost to the society of unhealthy lifestyles, due to we don't teach in school, we don't have very strong health educations in schools. We surround ourselves, and it talks a little bit about this in this chapter, but in other chapters as well, is we live in a society where McDonald's, fast food, is king and queen. It doesn't matter how much cholesterol you're putting in your body. Schools are famous for we just give the kids, the children, the students what they want. But in the end, health care costs are paid by everybody. It's not just a company, particularly those people who don't have health insurance. When people have to go to emergency rooms, when people lose time at work, when productivity goes down, I mean, in the end, society pays for it. All of us pay for it. And I just never quite understand why that message never gets amplified. It's just like, I don't get it.
Antonio, define all of us. You say that cost gets paid by all.
I mean, it eventually it's in our taxes. Eventually, it's reflected in lost time, lost productivity. Families, suddenly the breadwinners in a family can't work because they can't afford to get health care. I mean,
yeah, but
so it's just I don't mean that there's an economic cost necessarily, only there is a physical price that people who do not have access to health care and good health care pay for.
If the idea that costs are spread equally across society,
you're right.
Then yes, but that's not the case.
You're right.
Those costs are borne by, they're borne by largely people who are on the, 50% or lower. I mean, that's whose cost. That's the burden of those costs. It's not borne by those who are in the upper income price bracket. They got their own health care. And the terms of mentally ill people walking around the street and people homeless, that's not an issue to them. That impacts the other neighborhoods. That's the problem. I mean, it gets back to this whole concept of that profits are private. Basically your liabilities, your expenses, particularly for large corporations, are public. That's why a firm like McDonald's, and single out McDonald's may be unfair, but they're the primary one of the has low wage income that don't provide health care. Why should they provide health care? There are people that work there that make minimum wage. When they need health care, guess where they go? They go to the emergency room. Okay, people that don't have health care go to the emergency room. Who pays for the emergency room? Who pays for that by and large? Are people in those communities with lower incomes. Those corporations, and you can look at this, don't pay taxes. Since they don't pay they pay minimal taxes. Since they don't pay minimal tax, it's no impact to them, a limited impact to them. Once again, the expenses are borne by those who are at the lower end.
I'm just thinking about also, and I've seen plenty of examples on video and in stories where a person ends up in the emergency room because they don't have health insurance. They're given sometimes they're given pills to deal with it and told, go see your doctor. Well, I don't have a doctor.
Right.
And when those pills are gone, or go and fill this prescription, well, I don't have money to fill this prescription. I mean, I've noticed that in some of the medicines that I take now, I mean, I'm under Medicare, but I have Medicare Advantage. On some of them, the copay has actually increased with time. I mean, there is one particular pill that I was taking. I no longer take it, but it was before medical insurance, it was like $500. After medical insurance, it was $95.
Right.
It's not like I got $95 sitting around. but I'm middle class. I mean, I've got Medicare Advantage. You know, what's it like for somebody who has no access to those things? And this also extends not just to, young people and, married couples, middle class, but even the elderly.
Yeah, of course.
Who are receiving $1,000 in Social Security a month,
Mm-hmm.
or a couple of $1,000s in Social Security. I'm looking at the story where there was one of the items that was recently rejected by the Inflation Reduction Act was about capping insulin costs.
Mm-hmm.
Now, you would think that would be a no-brainer. No, can't happen. Can't happen. I just think that, again, as I said in the last chapter, even where this affects a large class of people in this country, I'm talking about economic class, inside that economic class, who is losing out? Who are the losers?
Mm-hmm.
And in most cases, they're people of color.
Well, I agree, but as this economy gets to be more and more of a dog-eat-dog economy, a zero-sum gain economy, I think it's majority of people. And yes, a large number of those people are people of color. But you know what? If this continues at the rate we're going with the income gap we have now, it's going to be the vast majority of people in this country are not going to be able to afford. And the thing that strikes me, even with the most recent passage, well, it hasn't passed yet, but the IRA passage. There's still.
No, I think he signed it, didn't he?
He signed it.
Whatever.
Well, no, it's gone to the House. Let's go to the House. It's not gone to the House.
Right.
I mean, I feel fairly confident it will end up with his destiny. We'll sign it. But the point I want to make is that even that was not just Stonewall, became at a serious fight. Insulin being one. Another health thing that just basically, frankly, flew under the radar was the burn pits with the vets.
Yes.
That's a health issue.
Yeah. Because who knows where they actually got it from? Because vets lie.
Yeah. I mean, it's that. It's the EpiPen thing, which EpiPens went up from $35 to $600. They did get it down, but it still is higher than it was before. And you said it; it is true. Healthcare is a commodity, and as long as we see healthcare as a commodity, we're going to have the disparities that we have now. And it's going to, unless the Democrats are able to pass more sweeping healthcare acts, like the thing about capping, and not just capping it, but when the cost of drugs, prescription drugs, exceed the rise in inflation, they were going to penalize the pharmaceutical company. That was struck out.
Yeah.
But until we have passage, wide sweeping passage for healthcare is going to become more and more unaffordable. It's going to lock out more and more people. And that's the unfortunate reality.
I'll end with your opinion on one of the answers or one of the solutions being proffered for years now is universal health care, socialized medicine. Is that the solution? What is the solution?
Well, it's certainly a better solution than we got now. And one of the things I find really interesting about this whole thing of socialized medicine and being a socialist, that for a long time has been used as a bugaboo.
Yeah.
Starting probably as going back as far as the 20s, but certainly in the 50s, 60s.
Yes, yes. Oh, yeah. Oh, yeah.
And it ramped up. The Republicans love to use that word, throw it out to anybody and everything that they oppose. But one of the things that's heartening to me, as the young is saying, shit, what's wrong with socialists? What's wrong with socialism? I mean, we have corporate socialism. Why don't we have people socialism? So that word is losing its sting.
Yeah.
And that gives me hope that we will have universal health care. Possibly not in my lifetime.
Yeah.
But certainly we'll have it in the lifetime of my kids.
Yeah, because this is not sustainable. I mean,
No.
it just really isn't sustainable. And I think also the pandemic really highlighted those differences between people who have health insurance and not, and more importantly, people who were sacrificed on the altar of the pandemic. I mean, I just want to close with this real quick, because the great examples are the food processing plants.
Oh, God.
Where people, majority of whom are people of color, and majority of them were Latinos, excuse me, were told to keep working right next to each other, in many cases especially at the beginning, with no mask. And how many died, caught COVID and died, and those numbers were hidden. And, the former president, whose name I hate to use, basically, put it as an industry that had to keep open.
Yeah, it was a critical industry, yeah.
A critical industry. So, that's, again, where, people are sacrificed on the altar of the economy, the predatory capitalist economy. And,
one thing that I wanted to say that this chapter was short and I thought they did a very good job of, but one thing that was a glaring omission to me was the number of people during the pandemic who worked in the healthcare system who died. And many of them were people of color.
Yes.
And they died, basically because out of ignorance. They died out of the fact that the country wasn't prepared. And we celebrated them, quote unquote, the media celebrated them, while this was happening. But afterwards, getting more money? No. I mean, they're having their status elevated? No. And, this again, back to this hypocrisy that, we have. And believe me, there will be another pandemic of some sort.
Oh, yeah.
I don't think we're not out of this one yet either. But
all right, we're not even finished with this one. Knock on wood, I haven't gotten it yet. Well, that's it for this chapter, medicine. We're going to move on to in the next coming weeks. We're going to be talking about church and music, healthcare, which we've already addressed, but there's some really interesting elements in the. So we'll actually be repeating some of these things, but there's a lot more detail in chapter 15 about healthcare. Then we talk about traffic. And I thought that was interesting because he said, traffic, what are they talking about? And it's something we talked about in the last chapter, talking about access to transportation and how do people get to and from their jobs. Then chapter 17 is called Progress. And then we'll end with chapter 18, which is called Justice, and is written by Nicole Hannah-Jones. And it's really a wonderful way to end the book, the 1619 Project. All right, sir, you have a good day. Thank you again very much. And this is Antonio Ruiz and Thomas Fields, 1619 Project podcast.